On the third day of Christmas, my ER gave to me a triple lumen cath, 2 trauma shears, and a CHF exacerbation. Let's talk about the triple lumen catheter. Most of it just call it a central line. So this gets floated into the right IJ, or the right internal jugular. It can go other places, but that's the most common insertion site. So then we float it down into this giant funnel that brings blood back into the right side of the heart, called the superior vena cava. And the tip of that hangs out right there. Now, we don't want to get it too far, because if we advance it too far and it goes down into the right ventricle freaks out about it and goes into a run of VTAC. But I know that's not going to be you, because you're going to be watching the monitor while the provider is inserting it. We're going to make sure they don't go too far. So once we suture it in place and you put a beautiful dressing on it, what the heck are we going to use this for? Well, it gives us a lot of information and capabilities. First of all, the distal port, which is the brown one here. And if you forget, in teeny tiny little letters, it says distal port. That's going to be the booty end of it, okay? Right here on this blue end. That is going to outlet right here if you were to push something through that brown port. But you're probably not going to, because that's going to be hooked up to a transducer, which we're going to connect to our monitor, and that's going to feed us information on the patient's central venous pressure, which gives us information like, hey, is there SVR so tight that it's squeegeeing a whole bunch of blood back to the right side of the heart? We have a whole lot of preload, or maybe it's the left side of the heart isn't kicking blood out, so it's backing up on the right side of the heart, or maybe the patient has lost all of their vascular tone and we're not getting any venous return to the heart, and so their CVP is like whippy and 0. That's the kind of information you're going to get from transducing this brown distal port. Now, the medial port, this blue one, that's going to outlet right there, that one. Think of medial as medicine. That's where you're going to be able to infuse all of your meds. And then the white one, the proximal one, this is where we're going to draw blood off of, because it's proximal, it's closest to this. So if you have to draw blood samples, you're probably not going to get nearly as much medication into it, because the medication is coming out after where you're drawing it from. So when you draw, make sure you are getting it from this white port. You can also infuse things through this port if you get in a pickle and you need more than just this one port here, if you have medications that aren't IV compatible. But there's just a little bit of information for you on the triple lumen cath.